Good day, everyone. In this video, we are going to see the International Medical Guide for ships, why it is used, and how to use it. Now, all of you have done your elementary first aid course. The junior officers must have done their medical first aid course, and the senior officers must have done their master's Medicare course. We do understand that on the ships, medical emergencies can happen at any time, and we need to refer to this book to administer first aid or to treat a casualty. What is given in this guide, medical first aid guide? So this is International Medical Guide for ships, and what is given in this is this information, that how to administer first aid or treatment in case of shock, pain management, head injuries, eye injuries and diseases, bone, joint and muscle injuries, abdominal and chest injuries, wounds, burns, chemical splashes, smoke inhalation and electrocution, heat stroke and other heat disorders, poisoning, examination of the patient, paralysis, strange behavior, unconsciousness, chest pain and other disorders of the heart and circulation, respiratory diseases, gastrointestinal and liver diseases, kidney and urinary disorders, pregnancy and childbirth, STDs, sexually transmitted infections, skin diseases, bone, joint and muscle disorders, tobacco, alcohol and drug use, infectious diseases, dental problems, external assistance, how to take medical advice, evacuation by helicopter, ship-to-ship transfer of doctor or patient, referral information to accompany evacuated patients, nursing care and medical procedures, death at sea, medical care for survivors at sea, environmental control and hygiene, preventing diseases and promoting health in seafarers, anatomy and physiology of the various systems we have in our body. To understand this, we have to understand that everything is made up of cells. Many cells combine together to form tissues. Many tissues combine together to form organs. Many organs combine together to form various organ systems, such as the skeletal system, the muscular system, the circulatory system, the respiratory system, the digestive system, the urinary system, the nervous system, endocrine system, the blood, the immune system, and IHR, International Health Regulations. So this and the SIPS medicine chest, which we will be paying particular attention on. Okay, so these are the contents of this book. All of you should familiarize with this book so that in case of an emergency, you know exactly what is to be seen and which topic is to be seen. Basically, the general emergencies, what can happen on the ship, are all mentioned here. Now, we cannot be doctors just by doing 2 days elementary first aid course or 5 days of medical first aid course, MFE course. But we can understand how to administer first aid. What is first aid? Basically, first aid is given to save somebody's life and to help recover the patient faster. Okay. And the time period in which the first aid is administered is really very important. You know, if the two things has to be present at all times: the blood circulation and the oxygen supply, the breathing. Okay, if a person is not breathing, if the blood circulation is not there, that means you have to administer CPR, cardiopulmonary resuscitation. Two organs we are going to discuss here. One is the heart and one is the lungs. The function of the lungs is to absorb oxygen. The alveoli in the lungs absorbs oxygen from the air what we breathe in, and the heart pumps the blood. This blood absorbs the oxygen from the lungs, and this oxygen is transferred to the various organs, tissues, and cells of the body. Now, if the blood is not transferred to these various organs of the body, they are not going to receive oxygen. Oxygen is required by all the cells of the body for metabolism. The weakest organ in this case, for this particular reason, is the brain. If it does not reach oxygen, if it does not get oxygen for about 4 to 5 minutes, it may fall unconscious. If it doesn't get oxygen for 5 to 6 minutes, it may go into coma. If it still doesn't get oxygen for about a couple of more minutes, then the brain may die or it may suffer irreversible changes. Okay. That is why oxygen is very important, and that is why we administer cardiopulmonary resuscitation. What happens is when you're giving CPR, you're basically artificially pumping the heart and artificially blowing the air inside the lungs, so that you are artificially making the oxygen reach to the various organs of the body till the time proper treatment is not received. All this is explained in this medical first aid guide. Okay, so this is about this book. I hope you have understood the contents of this book. This will really be very helpful for your examination purposes, or not for examination also, then when you're going on the ship also, it is really very helpful. It's very easy to read and understand. It tells you how to diagnose, treat, and prevent health problems in seafarers with the focus on the first 48 hours after injury. It is supposed to be kept in the ship's medicine chest, and you should familiarize yourself with the content before a medical emergency occurs. This way, when there is a case of illness or injury on board, you can immediately turn to emergency medical advice on the topic at hand. So chapter 1 to 24 is you have to follow this structure: general description of symptoms of disease, explanatory notes when necessary, signs and symptoms, few questions to ask, what to do and what not to do. These chapters also contain information on how to prevent specific injuries or illness by action that can be taken on board. General prevention and health promotion is covered in chapter 30. Since immediate response is essential for life-threatening conditions, the first 11 chapters cover the principles of first aid and how to respond to choking, bleeding, shock, pain, injuries, wounds, burns, and poisoning. Chapter 12 outlines the general principles of physical examination and the necessity of obtaining consent for examination and treatment. Chapter 25 describes how to use external assistance and seek medical advice by radio, and includes a general recommendation on the use of the digital photographs to assist in obtaining diagnostic and treatment advice in this context. It includes a form for obtaining and transcribing such advice. Chapter 32 contains the relevant articles of the revised international health regulations. And chapter 33 lists the necessary medicines for stocking the ship's medicine chest, including those which should only be used with radiomedical advice. This list is consistent with WHO's essential drug list and provides indications, doses, and specific precautions for each entry. Now let us see some of these medicines in the medicine chest. All the ships are required to carry this medicine as per the WHO scale. Apart from the WHO scale, you may need to carry medicines as per the flag state of the ship. Okay. Apart from the flag state, your company may also require you to carry some additional medicines. Like most of the companies now, they provide some certain equipment, emergency use equipment such as AED, artificial automated external defibrillator for heart. So these medicines are provided. You have to carry the medicine as per the maximum requirements. The ship's master is responsible for managing medical supplies kept on board. Although he may delegate responsibility for the use and maintenance to a properly trained crew member, nevertheless, however well-trained crew members are not medically qualified, a doctor should also always be consulted about serious illness or injury, or where any doubt exists about the proper action to take in treating a patient. Keeping records, a list of medicine and medical supplies should be carried on board and be regularly updated. The list should include for each item such details such as expiry date, storage conditions, and quantities remaining after purchase or use. A record of treatment given to any person on board, including the type and quantity of any medicines administered, must be entered in the ship's log. In some countries, it is compulsory to keep such a record. In addition, the master of the vessel is required to maintain a register of controlled drugs, and this register must not be discarded before 2 years have elapsed after the date of the last entry. Identification of the medicines. All the medicines listed in the guide are identified by the generic or approved name. Since local brand names may differ from country to country, the box or package for every medicine therefore should be labeled with its generic name. The dose per tablet, capsule, or vial per ampule and the expiry date of each item should be clearly indicated on the package or container. If the label is illegible, or if the contents of an opened or unlabeled package or container cannot be identified, the medicine should be destroyed. Storage. Drawers or medicine cabinets should be large enough to store medicines and equipments in an orderly manner so that they are easily identified and available for immediate use. This is particularly important for medicines and equipment used in emergencies. They should be kept separately in the most accessible place. Generally, items of the same type or category should be stored in a box, shelf, or drawer properly labeled. Controlled medicines must be kept apart in a locked compartment, preferably the master safe, in a room that is locked when unoccupied. And the expiry date should be mentioned of all the medicines. Okay. In pregnancy, before any medicine is given to a female patient, the ship's doctor or the officer designated as health provider should know if the patient is pregnant or breastfeeding and can safely take the medicine. Unwanted effects and drug interactions. All medicines have unwanted effects that must be evaluated case by case by the patient, the responsible officer, and the consulting doctor in relation to their benefits. Severe unwanted effects can occur when certain medicines administered simultaneously to a patient interact with each other. A doctor should always be consulted if a patient is already taking medication or if several medicines from the list in this guide have to be used together. Okay, so this is about the medicine chest. Now this book also gives certain specific medicines which are required to be carried, and most of the ships carry medicine as per this book. So this gives the list of recommended medicines and equipment which are carried on board the ship. Okay, so this is the list of these medicines which are required on board the ships, and also it gives a list of all the medical equipment which is required. Now, for example, this medicine generic name is amitocaine 0.5% eye drops, also known as tetracaine. It's a single-use vial for eye examination procedures. Consult doctor before using. You don't need to consult, so it says no. Adult dosage is 2 drops inside lower eyelid. Unwanted effects are transitory burning sensations soon after application, and remarks are unused portion to be discarded immediately after use. Okay, similarly, all the medicines are mentioned in this book. So you can directly refer to this book what medicine is to be used for what purpose. Then it also gives a list of all the equipments which are required to be carried on board the ship. So this is what you're seeing on the screen is basically the various medicines which are required to be carried by the ship and also their usage. Next, what we're going to see is the various equipment. So this gives the various equipment which are required to be carried by the ships. All right. Okay, so gentlemen, this was about the medical guide for ships, international medical guide for ships. Equipment required, what all information is available to us in this book. Thank you for watching this video. I hope it will be really useful to you. And please subscribe this channel if you like this video. Also, you share it with your friends, whoever is interested in this topic. Thank you for watching this video once again, and please don't forget to subscribe. Thank you.